The muscular system, let's go over the pictures from this worksheet. We have 6 pages that have images that you need to identify the name of the muscle based on where it's being pointed on any of these images, and you should know the action of each of these muscles. Before you continue, make sure you have already gone through the location and action of each one of the muscles and you already feel comfortable with them. That way, this video can help solidify that even more. From this first page of the torso, let's look at the external intercostal muscles. The external intercostals are located out here and they are between the ribs. We really aren't able to see any more. We're not seeing the internals, we can just see the externals on these cadaver images. Pectoralis Major is your main chest muscle. We can see because it starts from the sternum and it's actually attaching and converging onto the humerus. So it helps when the arm is up in the flex position, helps to adduct it and bring it back towards the midline. I should mention the external intercostals are useful for inspiration. They lift the chest up and out. Pectoralis Minor, here it is. It's more of a stabilizing muscle. We can see it's from these first few ribs here. Rectus Abdominis, that's our 6-pack muscle. In this view, you can see it as an 8-pack. External obliques are going to be out here on the outside, where the internal obliques are coming in at the opposite angle. Transversus abdominis is here. It's going around side to side. And then sternocleidomastoid, we're only seeing the very bottom part of it. It's this portion that's actually attaching onto the clavicle. On the upper portion, it's attaching to the mastoid process just behind your ear. On the posterior torso, we have the trapezius, which is located here. Teres major is this one. It's pretty significant, coming from the bottom of the scapula over to the humerus. Subscapularis is not in this picture, so we should exit out. Infraspinatus, which would be right here. You can actually see it under the fascia there. Well as right there. The deltoid is going to be the muscle here on your shoulder. It does arm abduction, meaning it's going to swing the arm out that way, away from the body. We have Levator Scapulae. We can see that coming up off of the neck onto this upper portion of the scapula. So when it contracts, it's going to lift that up, which actually causes the shoulder to drop. Latissimus Dorsi is the biggest muscle of our back. It is our primary mover in arm adduction, bringing our arms back down towards the midline. So it actually attaches to the arm. It makes for the posterior wall of our armpit. Erector spinae is a whole family group of muscles that attach along here to help to lift up our torso or cause torso extension. Then we have Triceps Brachii. It's on the posterior surface of the arm. It is involved in extension of the forearm as well as extension of the arm, bringing it back. Temporalis is the one on the side of our head. It attaches to the mandible, so when you chew, we can actually feel it on the side of our head moving. Masseter is on the ramus of our mandible. It is the primary muscle in mastication. Sternocleidomastoid, it originates back here at the mastoid process, comes across the neck, and it actually attaches here onto the clavicle. So it helps to turn the head one way, or if they both are contracting both sides at the same time, it can cause the head to tip down or flexion. The platysma, we can see it's a very thin muscle across the anterior surface of the neck. Orbicularis oris goes around the mouth. Orbicularis oculi goes around the eye. Back to Pectoralis Major again. We see that over on this here. And we have Pectoralis Minor. It's smaller and is underneath. The deltoid is here on the shoulder. I like to ask about the Latissimus Dorsi even from the anterior view because you can see it right here as it is coming up and attaching on to the humerus. Just above it, I'll put in dotted lines, is actually Teres Major. From this view, we do indeed see subscapularis. That is the entire deep portion of the scapula. Biceps Brachii can be seen on this view. We have the bicep muscle. It's a two-headed muscle. We can actually see one of the tendons coming up this way and the other tendon there. Meanwhile, brachioradialis is a little lower, and it is one large muscle also on the forearm. So it's deeper. It's underneath biceps brachii. Brachioradialis is starting from the brachia, which is the upper arm, down onto the radius. So we only see the upper portion, but this is brachioradialis in all three of these pictures. We can see rectus abdominis, or at least some of them. We can also see the external oblique and even the trapezius. So here we can see part of the trapezius here, and we can see a little bit of it right here. The forearm, again, brachioradialis, we can see that coming across. It's sort of the main one that we can feel on our lateral forearm. Then when we say flexor carpi ulnaris, now we know it's ulnaris, so it's going to be on the pinky side. It's a flexor, so it's going to be on the anterior side. So it would be this one over here. Now let's go to extensor carpi ulnaris, which means it's going to be on the posterior side. So we'll look at this picture, and it's going to be on the same side that the pinky is. So it would be over here. Palmaris longus. Palmaris longus isn't in everyone, but it's easy to see if it is there. It actually goes here to the palm, and it has a single tendon that actually is on top of the retinaculum, so it actually is quite prominent when somebody has skin on their arm, a live person obviously, and they go to flex their wrist, it will pop up. Pronator quadratus, right here, and that's going to cause the forearm to flip over to pronate. Extensor, so all three of these are going to be on the posterior surface. We already did extensor carpi ulnaris over here. So then we'll do radialis. I just included brevis. There's actually a longus. Brevis means short. So it's going to be here. And digitorum will just be the one in the middle because it's going to go to all the digits. On the torso and leg, we have the iliopsoas. That is the prime mover in flexion, lifting that leg up, flexion of the hip. So it actually comes from within the torso, goes under, so on the backside, and actually inserts onto the femur right there. We see the iliacus fibers here, and we have the psoas. There's actually two of them, psoas major and minor. So these two separate muscles, or three separate muscles, will converge. And so when they come out of the torso and actually onto the attachment point on the femur, that's where it's called the iliopsoas, because it's combining two different muscle groups. But it's very, very deep, obviously to the very back of by your vertebral column. It's anchoring as well as all around the pelvis. So this is a very, very powerful muscle that is the prime mover in flexion at the hip, which means lifting your leg up. Rectus femoris is one of the quadriceps muscles. It's the only one here at the top. It's part of the 4 quadriceps muscles, but of the 4, it's the only one that actually crosses the hip. So it is a synergist, or it helps the iliopsoas with hip flexion. Tensor fascia latae is part of your iliotibial band, and we actually see that right here, and it's attached to the iliotibial band as it extends on either side of it. This is used in standing. Sartorius goes across. Gracilis is going to be the most medial muscle of the thigh. We have adductor longus. It's in this adductor region here. You will not need to know the specifics. There's a number of other adductors, and to just minimize your confusion, I put it here because I wanted you to realize there's longus, there's magnus, there's brevis, there's 3 of them, and they are within here because they're actually going to bring your leg towards the midline, so they are adducting. Vastus lateralis and medialis, along with rectus femoris, and then we have one that we can't see, which is vastus intermedius. So those are the 4 quadricep muscles. You need to know all 4 of these. You only see 3 of them. So we already identified rectus femoris. This here is vastus lateralis on the lateral side and vastus medialis. Vastus intermedius is underneath rectus femoris. Gluteus Maximus, obviously, is the big muscle. Most people are already familiar with that, across the buttocks. Gluteus medius is just under that. You can see piriformis right here. It's a smaller muscle. It helps to rotate the hip laterally. Quadratus femoris is down here. Then we have the 3 muscles of the hamstring group, and we have them as semimembranosus and tendinosus on one side, and biceps femoris on the lateral side. So there are 3 muscles that make up the hamstring group. Iliacus, we already know is part of your iliopsoas. Iliacus is coming in here from within the ilium. Tibialis anterior is going to be on the front or the anterior surface of your lower leg. So it's sort of, if you feel it, you can feel it yourself just below your knee, and lateral. That's the soft muscle right there. Gastrocnemius and soleus are on the posterior surface. Gastrocnemius, we can see in this, it's a 2-headed muscle. There's one head here and it crosses and actually attaches to the femur, and the other head crosses the knee and attaches the femur there. So it is plantar flexion with the knee straight. The soleus, we can see, is deeper, and it takes up the entire back of the lower leg. It does not cross the knee, so we can do plantar flexion, but the knee is bent.